All right. Good evening, everybody. Thank you for joining us for our ATSU DMSc information session. And we'll have people pop in and come along as we can. That's great. We're happy to have everybody coming in and for this evening. And we'll try to make this as painless as possible. I know PowerPoint's never a fun thing to do, but hopefully we'll make it entertaining along the way for everybody. We'll do introductions. I'm Dr. Beth Poppery. I'm the administrative manager and an assistant professor for the Doctorate of Medical Science program. I've been with the university since 2005, and I will let Dr. Danielson introduce himself.
Yeah, thanks for joining us. Randy Danielson. I'm the director of the DMSc program at ATSU University. I've been with the university a little over 25 years now, both as the chair of the PA department and also as dean, and in the last whatever it is now, four years as director of the DMSc program. So glad to be here. Bert.
Hi, I'm Bert Simon. I have been with the ATSU University since 2005, served as the PA department chair and also the vice dean in the School of Osteopathic Medicine. And I have been full-time in PA education, even though I look young, since 1979.
You started at a very young age. You're a prodigy, right?
That's right.
Awesome. Joe, you want to introduce yourself?
Hi, I'm Joe Kopelman. I work in online admissions, so I enroll for the DMSc program as well as a few of the other programs offered at the Arizona School of Health Sciences. And I've been with the university for about 17 years now, and been enrolling for the DMSc program since it started up. So happy to be here.
Awesome. Thank you, Joe. And we also have Joan Meyer on the line with us. Joan is new to the university. Joan, you can unmute. Do you want to introduce yourself, Joan?
Sure. I'm Joan Meyer. I'm the Senior Director of Admissions for Online. I'm located here in Arizona, and I just started with the university. I think I'm maybe a month in, maybe 5 weeks. So I'm glad to be here.
Awesome. Thank you, ma'am. Thank you. So we have a small crowd, so we'll just kind of go around. If you don't mind, Christy, if you wouldn't mind unmuting and tell us a little about yourself.
Hi, I'm Christy Cobald. I am been a licensed physician assistant practicing mostly in neuro and surgical fields since 2006, and I've been in academia now since 2019. I'm one of the assistant professors and the director of program evaluation for the Franklin Pierce University Arizona Hybrid MPAS program. So ready to get some more knowledge under my belt so I can serve my students better and my own goals.
Well, thank you, and thank you for sticking with it. You're 4 years in, so you're seasoned now, so you've got to stay, right? Wonderful. Kimberly, if you can unmute.
Hi there. I'm Kimberly Calloway. Let's see here. I guess I had to put my video on as well.
Yeah, yay.
Yay. Hi. I have been a PA now for, a long time. 10 years in internal medicine and the last 4 years in plastic surgery specialty. And have a master's and figure no time like the present to start working on this doctorate.
There you go. Good for you. Awesome. Well, good. Well, I hope we'll be able to answer a lot of questions for you this evening. Chris.
Thank you.
Yeah, hi, I'm Chris Klemek. I'm I've been a PA for 17 years. I do pulmonary critical care medicine now. And I've done some leadership in the past, looking to move more into that. So I look forward to getting started.
Awesome. Thank you. Nicoletta.
Oh, hi. I'm a PA in dermatology, working for about 15 years. So I'm interested in doctoral degree, and I'm just, ready to ask a lot of questions.
Wonderful. We love lots of questions. Fabulous. Thank you. And is it Will? That's the screen name. I'm going to go off on a limb and say it's Will. Maybe not. Oh. Allison, thank you for joining us. Allison, if you don't mind, if you're able to unmute and tell us a little about yourself.
Hi there, everybody. I'm so sorry. I'm just stepping out of clinic right now.
Oh,
So
sure.
it probably sounds sorry for the brief delay in my logging on.
Yep, you're fine.
I am Allison Liebold. I'm a physician assistant at Stanford Healthcare. And super excited to learn more about the program and really appreciate you having the session.
Fabulous. No, well, thank you. Thank you for joining us. Wonderful. We have a great group this evening. So wonderful. So if you guys have questions along the way, feel free to unmute and ask questions, or if you want to just type it in the chat, we will be monitoring that as well. And we're happy to kind of go along. So we're going to dive right into our presentation. We're going to share my screen, show you our fancy PowerPoint presentation here. Hopefully, let's see. Dr. Danielson, if you give me a thumbs up if you can see my presentation, all right? Good?
Yep, looks good.
Oh, fabulous. I love it when it works. Love it, love it, love it. All right, so I'm going to just let you take the reins, sir.
All right. Well, so once again, thank you for taking a few minutes this evening to talk about the ATSU Doctor of Medical Science program. And it's been in existence now. I think we put it together in 2018, started in 2019, but I have to tell you that this program has been talked about by Dr. Bert Simon and his faculty, for well over a decade. We started looking at this many years ago and trying to develop what we thought would be an important curriculum for practicing PAs that would give them the skills to take their practice or whatever job they're in to the next level. So the program description you've seen online, but it really is a PA specific doctorate designed by and exclusively for practicing PAs. So PAs can become leaders with the insight and expertise to really help improve how healthcare is taught and delivered, whether you're in education, whether you're in clinical practice, whether you're in leadership position. Probably the most important things you should know about the program, number one, is it's flexible. And what I mean by that is we do everything we can to make it work around your schedule. It's 100% online, really. And the whole idea really was to minimize your career disruption while maximizing some new opportunities for you, whether you did regarding whichever concentration track that you decide. And you can continue to practice or teach whatever you're doing while you're obtaining our degree. And you see some great pictures there from a past graduation. So here's a leadership team. You've already heard from me, Dr. Simon's on, and Dr. Dare. I don't see her here yet, but she is our Associate Director of Research and Capstone Activities. Dr. Popra, you've met. Dr. McMullen is our professor and education track coordinator. And we also have a full-time instructional designer assigned to the program. She is worth her weight in gold and really is the architect of our entire curriculum to make sure that it looks the same no matter what block that you're in. The next slide really looks at the next two slides really is you'll see that almost 100% of all of our faculty are PAs. We have a couple of folks who have been at the university for a long time in research that we've grabbed a hold of to help us. But you see Dr. Jim Delaney, past AAPA president, Dr. Sandra De Palma, who actually works for AAPA, Dr. Larry Fisher, Dr. Mary Laxton, Dr. Frank Crosby, Dr. Melinda Rockcliffe, Dr. Kevin Kupfer, Dr. Joe Weber, and Dr. Melinda Gottschalk, and Dr. Jeff Alexander, who is one of the non-PAs, but been with us, just a wonderful guy helping us out with our capstone activities. Here's some more. Dr. Eric Matthews, a non-PA, again, very valuable person. Dr. Leon Moak is a alumni of our PA program. Dr. Michael Champion, Dr. Gaspar Rosario, Dr. Brian Norgren, Dr. Tony Steffes, Dr. Mike Hallisey, Dr. Jason Moore, Trenton Honda, and Michelle McMoon. And I wanted to say their names because you may know some of these folks, but we're really happy to say that we have the opportunity in an online program to reach out to faculty all across the country and in fact, all across the world. So we're really happy with these folks who have been dedicated to making sure that our students are successful. The next one is really the program attributes I talked about. It's 100% online. It's 36 credit hours. We'll talk more about that in a few minutes. You can complete this if you do the entire program. You can complete it in 2 to 3 years, depending on how many courses that you take per block. We currently have 6 specialty tracks. We'll talk about that. All of our courses are 10-week courses, and which is pretty fast if you think about it. That goes fast. We have 4 start dates per year, July, October, January, and March. So you can start at any one of those times. Go to the next slide. We really have a number of tracks. So if you go to the website, you could say, if you're interested in a particular track, this is the information. So we'll start real quickly. We have a leadership track. It's probably one of the 2 most asked about tracks, and that in education. And the leadership track really provides PAs with sort of a foundational leadership knowledge, looking at organizational leadership, health economics, ethical considerations in health administration, and PAs in healthcare policies. I think if you look at that, you can see those are important things for a PA to have if they're moving into any kind of a leadership track. The next one is the education track. And I know we have an educator here tonight. If you're in education or you're interested in moving into PA education, this is the track for you. It really looks at developing teaching skills for both the clinical and academic environments. And the courses are adult learning theory, curriculum design and delivery, educational technology and simulation, or we have a elective for PA program administration for PAs who may want to move into PA chair or higher administration. And we have a course in assessment and evaluation, all important things for the person in the education track. The next one is the professional practicum track. And I'm going to stop and let Dr. Simon talk. This is he's in charge of our professional practicum track. And Dr. Simon, you talk a little bit about that?
Sure. I feel real lucky because I get to teach in the leadership track, the education track, and also the professional practicum track. So this track was designed to offer students an opportunity to design a curriculum of topics that they're interested in. So a student can design a project that covers all 4 courses, 12 credits worth, or they can design, one that's just 3 credits, or one that spans two of the courses, however you want to do it. They write a learning proposal, and that's reviewed by myself. And then we negotiate through that. Once we approve it, student conducts the project and gives progress report and final report. So it really is an opportunity to let the student pursue something of interest to them personally that they'd like to develop some expertise.
Excellent, thank you. Another track that we have, and this is something that we partner with our sister school, the College of Graduate Health Studies, because they provide this and we partner with them. And this is the global health track. We've had a lot of folks interested in this. And this really looks at specialized knowledge, advancing critical thinking, and promoting theory application in global health. And so students learn about global health issues and the tools necessary to apply that knowledge. And the courses are global health issues, public health emergency preparedness and disaster response, globalization and world politics, and PAs in healthcare policy. So that's the 4 courses in that particular track. The next one, also partnering with our sister school, is the public health emergency preparedness and disaster response track, allowing students to play a role in public health emergency response. And this has worked out for folks who are very involved in their community EMS system or other community activities. And it provides students with an understanding of emergency management systems and introduces them to various forms of disaster and public health threats, certainly things that's happened in our world, obviously, in the last decade. And the courses in that track is Introduction to Public Health emergency preparedness and disaster response, global health issues, and epidemiology. Okay, so that's sort of, another one, again, with our sister school, is Public Health Community Workforce Track. Again, students looking at public health issues and their impact on the community, looking at introduction to public health emergency preparedness and disaster response, public health disparities, health equity, and COVID-19 and epidemiology. And so that sort of gives you an idea of the different tracks, 4 courses in the tracks. In addition to that, we have core courses. So with a total curriculum of 36 credit hours, our students take these courses: medical writing, foundations of doctoral studies, community assessment and health promotion, social and behavioral determinants of health, research methods in healthcare, and quality improvement in healthcare. So if you think about, those are all topics that really could enhance, our practice, as a PA, whether it's in clinical practice or in leadership or in education. We have 3 capstone courses, and then the 4 tracks that we just talked about a minute ago, for a total of 36 semester hours. Probably the thing that I want you to know is that ATSU bends over backwards to provide academic support. We have a wonderful university writing center. It's part of your tuition. If you have documents that you want the writing center to review, they will do that. They have a turnaround in 24 to 48 hours, and they give writing support for, we use, our formatting is AMA style. And so they work really well with all of our students. We have an online library, again, part of your tuition. This is available 24/7, access to materials, professional research librarians. We have a librarian that's dedicated, right to our program and has worked very well with our students. And faculty, as we talked about before, we have the opportunity to reach out to find the faculty that we need. Our capstone faculty, once you start your 3 capstone courses, you stay with the same faculty member all the way through those three capstone courses. And you have an opportunity, not only in capstone, but with any course, having some one-on-one time with any of our faculty members. Okay, next one. Is Dr. Dare here? I hadn't seen her here yet.
I do not believe she is. Nope.
Oh, okay. Well, then I will substitute for her. So it's a doctoral program. So we do have 3 capstone series, and we ask our students to create a scoping review and a translational project. So what does that mean? So in capstone 1, remember, each one of these courses is 10 weeks, and you stay with the same faculty member. So in capstone 1, you select your topic. You create a scoping review protocol. Think about a literature review on steroids, if you will. We review scholarly writing, look at best practices, engage our university resources, and basically come up with a topic that you want to have as your final capstone deliverable. Capstone 2, you complete your scoping review. You review evidence-based practices to assess the quality of the literature. And then on to capstone 3, where you review concepts related to translational research and implementation science, and you design a translational project. And so this prepares you with a foundation to do something with it. It doesn't have to be done while you're in the DMSc program, but this is something that once you graduate, you could take and turn it into something, whether it's a paper, whether it's a presentation, whether it's a poster presentation, on and on, depends on the type of project that you decide. And our capstone faculty, our facilitators work really well. We keep each of those 10-week courses with the capstone faculty member to about 10 or 12 students, so that there's not a whole lot of folks in there, so they can have a lot of one-on-one experience. So next one is Dr. Popper. I'm going to let you talk about this. Is something that I know you're very proud of.
It is, it's absolutely amazing. Our student and alumni ambassadors have been wonderful. Some of you might have actually known a colleague that's been through the program or is in the program, and they're just been the backbone for us. And it's, you want to hear from somebody who's experienced it, been through the program, finished the program, has the t-shirt, to show it. So it's always great to have those folks, and their current students and alums. We have well over 20 current student ambassadors, and I believe I have probably like 30 alumni ambassadors as well. They're from all the different tracks. So admissions can easily pair you up with an ambassador who would love to talk to you about what it was like to be in the education track, what they're doing with the DMSc and leadership or the professional practicum, what were some of their ideas, projects they did for the practicum, what did they do their capstone project on, what was the workload like? We get that question quite a bit. How much time will it take me each week to complete the program? And they're the best folks to talk to about that. So they are wonderful. They're very open to talking to people at email, phone call, Zoom, whatever format is a preference that you might have. Our student leaders, Dr. Simon and I meet with the student leaders twice every block. So like in week 2 and week 8, I believe, and they've been invaluable. With an online program, it's hard to kind of feel part of a program and part of a school when you're just kind of sitting at home doing your online work in a vacuum. But the student leaders have been great. They have hosted virtual networking events. So they set up Zoom nights and all the students can come in, and they do breakout rooms. So you get to meet your colleagues and have different conversations. So that's just been wonderful. And they've just been great. They actually survey the students every block and ask if they have input or feedback or questions. And they come and they bring those to us, and we've made some improvements to the program along the way over the past 4 years based on some of their feedback. So it's just been phenomenal, that involvement. And it's just really nice. And these are actual pictures of our student leaders and ambassadors. I didn't just pull these off the internet. So these are really our real peeps out there. So Dr. Danielson, I know this one's very dear and dear to you.
Yeah, about 2 years ago, we decided we wanted to provide not only for students and DMSc faculty, but for even those who were interested, a monthly master class by inviting folks in the profession or in medicine in general who have really made a difference. And so we meet with them for about an hour once a month. And for instance, we've had Bill Colehep, who's a past AAPA president and PAEA president and NCCPA president. Anyway, we've had Don Morton Rios, who is the president and executive director of the NCCPA. We've had some PAs who have been PAs since 1973. And so we just reach out and find folks who we think that folks would be interested in listening to. There's no cost for this. Again, it's a monthly online session, and sessions are recorded and then archived. And so anybody who wasn't able to listen to it can go there and listen to it. I'll give you an example. One of our first folks was actually a PA who was a graduate of our PA program, who was also not only being a PA, but she is a voice actor and actually has her SAG card. And we have a PA who not only is a PA, but also writes health children's books. So an opportunity to listen about what's happening out there in our profession. And, it's really wonderful. In December, we have a PA who not only has started 3 PA programs and a DMSc program, but teaches wilderness medicine. So I could go on and on, but that opportunity is there. And I think Beth's putting the site in the chat if you want to go there and see some of the ones we've done before. It's sort of an interview, and we get an opportunity to hear what their life's about. So I could go on, but I'll stop there, Beth.
Wonderful. Thank you, sir. And we do offer CME credit for every one of the courses. The entire program, all 36 credit hours, 13 classes equals 60 Category 1 CMEs. So if you get CME reimbursement, it's a nice way to kind of dip into those funds if you're able to do that. We will issue CMEs at whenever you would want them. If you want them as soon as the block is finished, the semester is finished. Some people wait until the entire program is finished, and I'll do one certificate for all 13 courses. But they are always there for students to avail themselves of. And it's just been a nice benefit that I think people have come to appreciate from the program. So. And then our alumni and students in action, we encourage you, if you're not following us on our social media, we have a Facebook page, a LinkedIn page, Instagram, Twitter/X, whatever it's being called now. And we'd love to highlight what our alumni and our current students are doing. We have well over 65 peer review. That's probably more like, I think 90. I need to update that number. And also on our website, if you go to the DMSc website, atsu.edu/DMSc, about third of the way down the page, you'll see accomplishments, student accomplishments, and that page has all of the current accomplishments from our students, their publications, their poster presentations, their new positions, their jobs, faculty appointments, new leadership, opening new clinics. A couple of our graduates are medical science liaisons now. So MSLs are becoming a new career path for PAs in that vein. And some of our ambassadors are MSLs as well, and they're happy to talk to you guys about that path if that's of an interest to you. A lot of them are on state committees, national committees, and then we have some that are owning private practice, and if they live in states for that. So I would encourage you to check out that page and see what those folks are doing. So they've been doing quite a bit. So for our program question, Joe, I'm actually going to turn this over to you. Do you want to go through these next couple slides?
Yeah, absolutely. So as you can see here right now, tuition is $652 per credit. And with that, we're looking at a $38 per credit technology fee. Total with that is a $690 per credit. And with the 36 credits, that comes out to just under $25,000. We're looking at $24,840. Tuition increases, typically we see about a 2 to 3% increase per year. Sometimes there's no increase at all. It just depends on what the board decides, but usually it's never above a 3% increase. And it's been a while since we've seen anything jump that significantly, even though it's not very significant. Textbooks, pretty much everything in the programs, and correct me if I'm wrong on this, but there are very few physical textbooks for any of the courses. Everything's going to be available as ebooks through our library. And in addition to the actual course materials, you'll have access to everything in the library beyond what's just assigned, which will definitely come in handy for your capstone courses or anything else that you're looking to do in the program there, especially, or if you're doing the practicum track, you'll have access to our entire library there. We do have, the program is eligible for financial aid, and that's something we can put you in touch directly with the financial aid department. If you have any questions about that and you're working with either me or Tim Flores or Deb Noble-Peterson in the online admissions department, just let us know that you are interested in financial aid, and we'll get you in touch with the right people on that. We do offer 20% discounts for a few different students, military, that'd be active duty, and also veterans. We also, ATSU alumni, so if you've a graduate of our campus PA program or another one of our programs here, we can get you a 20% discount on that. And then if you are a full-time employee, and I do not know what the acronyms stand for,
Federally qualified healthcare and National Association of Community Health Services.
Exactly.
Yeah, there you go.
And so, yeah, so that you would qualify for up to 20% off there, or you would qualify for 20%. It's not up to, it's 20%. And we also offer advanced standing. This is something that we started doing that's fairly new. I've only enrolled a few advanced standing students, so I'm somewhat literate on it, but probably just enough to get me into trouble without the actual cheat sheet in front of me.
No, that's fine. Currently, we're doing advanced standing for alums of the ATSU PA programs. So, which is, it gives them a 12 credit hour jump start, if you will. So they do finish 24 to finish the degree, and those are our alums of our programs.
Yes, that drops in
addition to getting the 20% alumni discount. So.
Yeah, it's about 18 months, a little bit less than that to complete.
About 15 months.
15 months,
15
even
months.
better.
Yeah.
So yeah, if you are an alum of the campus-based PA program here, that would be something you'd want to look into.
Awesome.
Application process, it's really straightforward. It's a lot easier than applying for PA school. I can definitely tell you that. We have an online application. You can access that at apply.atsu.edu. We do not require GRE. We do not require letters of recommendation, so you're not waiting on a third party to get something to us outside of your official transcripts. So basically what we need is the completed application online, a copy of your current CV, official transcripts from whatever school you graduated from where you completed your PA program. And if that is different from your master's, we'd also need the your master's degree. So if you did an entry level that was a bachelor's once upon a time, we would need that as well. Also, we do accept bachelor's level PAs into the program. There are several different ways to do that. Probably the most common one that we see now is if you've been an NCCPA member for 10 years straight or more. We can go ahead and enroll you in the program, basically a master's equivalent student with just a bachelor's degree. So that's something you definitely want to talk to either me or one of the other enrollment counselors here about. We do have a few more options there. So if you don't have your master's degree, it's not something that'll shut you out of the program. Just make sure you talk with an enrollment counselor and we can work out whether or not you'd qualify under the master's equivalency option. And then we just need a copy of your current PA license, and that is pretty much it. If you do qualify for any of the discounts, then we would need a signed tuition discount form as well. But it's a very straightforward enrollment process.
Perfect. Thank you, Joe. All right. And like Dr. Danielson was talking about, our next start date is going to be January 8th. That is what we call our spring semester, spring block 1, 2 blocks in each semester. The deadline is December 8th, I believe. Joe, I think we've pushed that out to probably December 15th because we've got
Correct.
a little more wiggle room around the holidays. We do, the university does close between December 25th and New Year's. And then our next start date will, after that's going to be later in March 25th, and then July 15th. I'll tag on to that and say break-wise, if we talked about the classes are 10 weeks, there's 4 10-week blocks in a year. We have 1 week break between the fall block 1 and fall block 2. We call that our fall break week. And then there's about 3 weeks between when class ends in December and January. There's usually 2 to 3 week break. And then in March, we take a 1 week spring break, which is the university's traditional spring break. And then right after the end of spring semester, which ends right around the end of May, 1st of June, there's like a 6 week break. So there is a little bit of a longer break in between that time. And we just kind of tell folks, kind of plan vacation, life, kids' activities, graduations, all that fun stuff around those dates that we've got going on. And we make sure you guys are well aware of all those fun dates that are coming up.
I would just suggest for anybody looking at that January start date, go ahead and order your transcripts, even if you haven't started your application. Order your transcripts to be sent to us as soon as you can, just because university registrars or transcript departments do slow down a bit as we get closer to the holidays. So this time of year, earlier is better for any third-party documentation there.
Good to know. Thank you. All right, here's the fun part. You guys get to ask us questions. Feel free to unmute yourself, put it in the chat, whatever you've got. You got questions. If not, we'll start making them up. We're good at that.
Hi there. I have a question. This is Kimberly.
Yeah, Kimberly. Yeah.
So I'm just curious because it says the timeline for completing the program is 2 to 3 years. There are some programs that I don't know if they're accelerated, but they complete in 1 year. Can you talk about the difference in terms of timeline and what your program has in comparison to those that are shorter in duration?
Sure. I'd be happy to address that. So when we first started the DMSc program in 2018, 2019 with Dr. Bert Simon, we looked at what curriculum do we think would be valuable for a PA to have? And we came up with a number of courses, which we just talked about today. At that time, we were one of 3 programs started. One was Lincoln in Tennessee. The other one was Lynchburg in Virginia. And we were all about the same, 2 years, 2+ years. But in particular, Lynchburg has worked out some advanced standing opportunities to reduce their program to 12 months, and that's great. My suggestion to you is take a look at the curriculum, see what it is that you want to gain from a curriculum. And I'll be honest with you, I have a good friend of mine who came to me just last year got hired by a pharmaceutical company who said they'd pay for her degree. And she said, well, I don't know whether to do your program or Lynchburg's, but Lynchburg's only 12 months. And I think I'm going to do it because it's only 12 months. And I said, well, if that's what you want to do, if you want to do a 12-month program, go for it. You know, however, if there's some curriculum that's going to be valuable to you, take a look at what you want to do. So having said that, right now there are about 16 DMSc programs out there and probably a few more starting. And, you know, while we're working on some opportunities for advanced standing, we talked about that earlier. Our students, you know, get 12 credit hour advanced standing. If you've completed a fellowship or residency, you know, we have an opportunity to offer you some advanced standing in our program, but it really depends on the curriculum. So you have to figure out what it is, what you want. If you're interested in getting a degree in 12 months and that's it, then so be it. So I hate to be blunt about that, but it depends on what you want. Does that make sense?
Yes, thank you.
Yeah. And Dr. Danielson, I will add on to that. You know, and we are brought, Dr. Danielson has not mentioned, and I'm going to shout him out, and I'm going to mention this for. So he contacted all the other DMSc directors and said, hey, what do you guys think about getting together and having some kind of regular meeting as a group? Let's discuss how we're all doing as programs together. And they started a consortium. And in their first meeting, everyone he invited, they all came. And they petitioned AAPA to do a special interest group, which they accepted. So they
PAEA.
PAEA
That's
to have
right.
a special interest group. Thank you for the correction. So that is now an official special SIG for PAEA. And everyone he invited all came, and they were very excited. So it's nice that they're all having conversations together, and we all see each other at conferences and whatnot, and we kind of joke. We're not like used car salesmen trying to undercut each other on, you know, the extended warranty program or, the low mileage car or stuff like that. We know everybody's got different things to offer. A lot of our core courses are similar. Some schools, their courses are 6 weeks long. Some are 7, some are 8, ours are 10. And our students are telling us that it's a lot. And even in 10 weeks, it's a lot of information to even put into 10 weeks. And I dare say we probably are leaving some stuff out because it's almost impossible to get it into that. And so we really wanted to say, it's not just here's the degree plan, 13 classes, check them off and see how fast we can get through them. But there's meat to them, there's substance. And when you finish capstone, and I tell everybody, when you finish this program, you're going to walk away with an amazing, at a minimum, amazing poster presentation, articles for submission. So we want you to have that tangible product. And it's not that Lynchburg doesn't have that. It's just that we do it differently than they do.
And I would add on the longer end of that, you know, we also have the 3-year track, which is pretty much one course per quarter. And with that, we see a lot of PAs who are working more than 40 hours a week or have significant family or volunteer obligations, just things that really sort of are already taking up their work week, and they don't have the time for a 1-year or even a 2-year track. And with that 3-year track, we also see a lot of PAs who are working for organizations that cover their tuition or part of their tuition through a tuition reimbursement or tuition assistance program. And so we'll see a lot of PAs that are wanting to maximize those benefits, where, you know, they're getting the majority of the program covered by employer funding versus out of pocket or financial aid or anything like that. So that's another option that we have. And we do see a lot of people that kind of see value in the longer program as well. So just want to put that out there.
Awesome. Thank you, Joe. I know I'll just keep piling on to it. I will tell you that we also know it's how busy you guys are. You have busy lives, work lives, personal lives, and some students start in the 2-year track, taking 2 at a time, and go, you know what, I just need to slow down. Not a problem. We've moved people to the 3-year track to slow them down. Some people are like, I think I might have a little extra time. We can adjust the schedule as we go along. And we've had some people that are like, they've been in the military, they've had babies, they've had sick parents, things like that, and they've had to stop. And we are vehemently not opposed to saying, you know what, if you need to take a block off, take a block off. We'll reset the schedule, keep forward motion for you guys. So we never pressure you to say, no, just stay the course, stay the course. And we get it. And all your faculties are PAs. You know, they're in clinic the same time you're in clinic and grading papers when you're writing papers. So awesome. Other questions?
I did have a quick one. Since you brought up, you know, kind of moving or sliding the curriculum back if somebody needs to, or pushing it out if somebody needs that due to their other obligations. How is there a time frame or timeline within which the program must be completed?
Yeah, 7 years.
But it
That's
won't take you-
that's pretty common among higher education institutions for a doctoral degree. Usually for a master's degree, you need to complete within 5 years, doctoral degree within 7 years. But I think it depends on the circumstances, but that usually it's 7 years.
Thank you.
And I think in the 4 years since we've had the program, 3 graduation classes. Now we've graduated over 200 students. We have about 200 in the program at any time. And probably I think the longest anyone had to take was maybe close to 5, and that's because they needed a year's leave off. I think they were military and got deployed. So yeah. Yeah. And that year actually does not count if you're deployed military. So we don't count that year. So Dr. Danielson, you want to talk about how much time during in a week? What kind of time commitment are we looking at?
Yeah, that's a great question because, you know, as a PA educator, you always like the answer, it depends. And, you know, and it really does depend. When I'm talking to our students and our graduates, on the average for each course, each 10-week course, we think that it's an average of 5-6 hours, maybe 7 hours per week of studying, responding, you know, reading papers, watching videos per week. So let's just say 6 hours a week is probably pretty common. So if you're doing 2 courses per block, then you double that. So 12 hours, you know, per week. So I always say that if you're going to take a course, 1 course per block, it's like working an extra day per week, you know. And so, you know, and if you have a day off, that's perfect to do that. But I think 6 to 8 hours per week is probably a decent, and it may change as you get used to how our curriculum works, get used to how Canvas, our learning management system works, you know, and you find out that most of our courses have discussions that are due on Wednesday night and Sunday night, and when the papers may be due, you may be able to do it in less time as you move along. So that's my answer. I think our alumni would agree with that.
Kimberly, did you have a question?
Oh, no.
No?
Good for now.
Yeah,
Thanks.
okay. Yeah, no worries. You know, the nice thing is the classes are 10 weeks in length, but 1 week before class starts, classes start on Monday and the end on Sunday. Each week goes Monday through Sunday. A whole week before class starts, the block starts, we let you see the syllabus. So you can get into Canvas, you can see the syllabus, and I tell people, look at that syllabus, write down every single due date that's on there in whatever calendaring system works best for you. Backtrack your life from when those assignments are due, the discussion posts are due, and then the Friday before class starts, you have full access. So we kind of give you a jump start weekend to get going into the course, to kind of see where you're at. And then it's not self-paced. You know, there are weekly discussion posts and you kind of need to keep on track of those, but you can at least look ahead and see where you need to be, because you'll want to turn those papers into the writing center in enough time to get it back and get feedback. And they turn them around in 24 hours. They're amazing. They're just absolutely amazing. Our online librarian's amazing. If you can't find an article, they tell you, if you've tried to search for something 3 times, stop, email them, tell them what you're looking for, and they will send you the links to help you find your searches. So they're just fabulous support. And everybody's always sad because when you graduate, you don't get access to up-to-date anymore. I hear that from all of our alums, like, can I keep up to date? I'm like, sorry, I wish. Great questions.
Yeah, I might add as well, the real question, and I'm not asked this as much anymore because the DMSc programs now have been out for a while, but why in the world do you want to get a doctoral degree, you know, as a PA? Why do this? And the answer that we hear from our students and our alumni is that number one, probably the most common one is, you know, I've been a PA for 20 years and I'm sort of wanting to move into education, and I want to have that. I want to have some. I really need a doctor. This day and age, you're going to need a doctoral degree in the future to work in PA education, and so I want to do that. I want to be a good educator, and either I'm already in education or I want to move to education. The second one, as you know, is many of our colleagues are now moving up into leadership, whether it's in a clinical institution, or whether it's Mayo or Cleveland Clinic, or I can go on, where PAs have now moved into the C-suites. And having that doctoral degree gives you a ticket to be at the table. And so I want to move into leadership. The third reason that we're finding out from people, honestly, whether we like it or not, is competition. Not competition out there, not only amongst ourselves, but amongst our nurse practitioner colleagues and their doctorate. So having that, another reason we find out is that people want to have that to enhance their clinical acumen in clinical practice. And I could go on and on the reasons that people do that. However, I think I'm trying to think, the train has left the station in terms of where PAs are going, and we're seeing more and more. Obviously, 16 DMSc programs. That's not to say that the number of DHSC programs out there, PhD, EDD out there, and we're seeing PAs moving into that too. And we need that. We need more researchers. We need more leaders in the profession, and more. And obviously, with the increase in the number of PA programs and the requirement going towards a doctoral degree, we don't have enough educators. So we need to do that. So that's why we're finding out that people want to do this. And lastly, there's just some people that says, hey, I've been a PA for 40 years. I want to retire. I want to do something else. We had a student, and I think it was our first graduating class, who was 70. He wants to write a book. He owned 2 or 3 different clinics, sold them all, and retired, and is going to write a book. So everybody has their own reason for doing it. You have to decide what that is, but there are certainly good reasons out there that's going to help you and help the profession. Whichever program that you go to, find the one that works for you.
Thank you, Allison here. I'm a PA. Practicing PAs has been really helpful to hear all this information, and you took the question that was on the tip of my tongue there. To kind of add to that, from your perspective, I guess a 2-part question for me. What, and you may feel like you've already answered it with what you just said, but what characteristics or reasons for coming in and doing the program have you seen lead to PAs feeling like doing very well, really succeeding and getting a lot out of the program? And I'm asking more about the timing of entering the program in one's career. And if you could speak to students who've come in maybe earlier in their career, a little sooner rather than like the 24 years that you brought up.
Yeah, great questions. And I don't mean to take all the time. I would appreciate others who want to answer this, but we're finding out that, and I can't tell you what time in your career should you look to a doctor. We have people right out of school. And my only suggestion then is make sure that you've been out of school long enough, that you've established yourself, that you're going to find a way to have time to move into a doctoral program. A doctoral program, a PA doctoral program, is not PA school, even though we remember what PA school was like. Well, maybe I don't. It's been too long, but it makes sure that you're established. But we do have a number of folks. The majority, and Beth, you could look at this, but I think the majority of our students have been out 10 or 15 years and are finding ways, saying, I need a doctorate to move into whatever the next thing is for me, and then we have a number of folks, who've been out 35, 40 years. So I'm not answering your question because it depends, but having said that, the other question was, when should you start? Well, we have 4 start times, as most programs do. You have to figure out when it is that you're going to have some time on your hands, to put that minimum 6 hours a week or 12 hours a week, depending on which one that you do. I'm going to shut up there, Beth or
No,
Bert
no,
or
no,
Joe or
no. Yeah,
yeah.
no, you're fine. No, Allison, it's a great question. And I will tell you, when we started the program, the average age was about 44. And over the last 4 years, we are slowly starting to see that average go down. And that's obvious because more and more PAs, as they're graduating or getting ready to graduate, are looking to, well, maybe I should go on and just stay the course with my education at this time instead of waiting. And so we are seeing more younger students, younger PAs enter the program, and I think it's adding some great conversations. We did have what we had an early entry PA program. We were letting our PA students start the DMSc while they were in the last half of their clinical year. And they were adding some great conversations to the online, discussion boards, and it was wonderful. Some of the other PAs that were in it didn't realize they were still PA students. We transitioned that to an advanced standing program for our PA, so we no longer have that for them because imagine that's a lot, PA school and DMSc. But they're really seeing the value, and sometimes it is, like Dr. Daniel said, helpful to get some experience first and then be adding to it. But I don't think that it's a detriment either. I think that they've added some really rich conversations. So it's nice to have all the wide variety. Plus, it gives them some networking and some resources too as young PAs.
Thank you. That's really helpful.
Yeah, you're welcome.
Another question that comes up is, what do I have to do each week? I've been out of, either I'm not technologically savvy, or if I am, I'm busy. What do I expect? And all of our courses, as Dr. Popre said, 10 weeks in length. We rely heavily on weekly discussions. We give you an article to read, a couple articles, a couple of videos to read. Like we start our course on Monday. By Wednesday night, we ask you to respond to some questions on our discussion page. And then by Sunday night, we ask you to review at least a couple of your classmates and respond to them. So to me, that's the fun part of the course, is you get to interact with, 15 plus of your fellow students, depending on what the topic is. I teach medical writing, but you get an opportunity to interact. And then there's some deliverables, some papers that are due, during that course. But the thing during the week that's probably to me the most fun and labor intensive is reading and viewing things and responding to that on the discussion side. And so, like Dr. Popper said, we start Monday, we go through Sunday night for our week. Another thing I might add is, and we talked about this a little bit. We all know life gets in the way. We're all busy. We all have families. We all have parents to take care of, grandkids to spoil, whatever it is. Things happen, and we take that into consideration. And so we are flexible. All we ask our students to do is keep in touch with us. Something happens in life, you get sick, somebody else gets sick, and you might not be able to make a particular deadline. We work with you on that. That's what our faculty are dedicated to say. We can work around that so that you don't think that this is the biggest issue. The biggest issue in your life is taking care of your family or whatever it is. So we talk about this all the time in our faculty meetings.
We are getting really close to that top of the hour. So this has been wonderful conversations with everybody. Thank you. I have emailed several documents to you, and please let myself or Joe, and Joe, it's online inquiry at atsu.edu. Yep.
Thank you.
Yeah, no,
Yes.
thank you all for joining us. We truly appreciate it. Thanks. Have a good evening, everyone.
Thank you, guys.
Thank you.
Bye.
Have a good night.
Bye.